So, welcome back for the latest episode of Taking Charge of My Cancer podcast. And I have an amazing guest today. This is Maria Garcia. So, Maria is a rehab aide here at UF Health with a strong passion for providing empathetic and inclusive care for her community. She currently on track to pursue her doctorate of physical therapy at the University of South Florida this August. Maria brings hands-on experience and deep commitment to helping patients heal and thrive. Over the past year, she's worked here at UF Medical Plaza following a 4-month APK Applied Physiology and Kinesiology internship that first introduced her to the field of oncology. Her daily work alongside an innovative team of physical therapists has been giving her a grounded understanding of the rehab process and the importance of compassion, evidence-based care. She hopes to continue to grow her knowledge based on pursuing a lifelong journey of learning. So,
Yes.
Maria, thank you for doing this.
Thank you, Durley.
So excited to do this with you. She's leaving next week, so we're gonna be sad about that. We're gonna miss her big time. So, Maria came to us as a volunteer. What year was this?
So I started as a volunteer in, I think it was September of 2023.
Exactly. And the moment she stepped in the clinic and she started helping us, and she was just so like in tune with what we were doing, asking questions, being on top of things. It's like, Maria, you wanna do? She was an APK at that point in the APK program, so they have to do an internship. So I actually offered her an internship since she was a volunteer, and it's like you can consider other options, of course, but so she did that. So she came in, did her internship with us, and we kept her, and she worked with us for a year now, almost a year. And now she's moving on in a few weeks to pursue physical therapy. So I think she's going to be amazing. So, what inspired you to pursue a career in physical therapy?
So thank you, Durley, for inviting me on the podcast. First of all, it's been a journey, and I'm so fortunate to have been able to land this job and this career and this internship and everything along. This journey has just been wonderful. But what inspired me to pursue a career in physical therapy? So I always bring it back to my parents. My parents both lived very active lifestyles growing up. My mom teaches Zumba, like that's what she does as her career. And then my father, he is really involved in the ultramarathon adventure race community. And he even opened a active running lifestyle store when I was younger, where he sold running apparel and shoes. So I was really always immersed in that community of active people. And I wanted to pursue a career that kind of incorporated that. But also I have this innate sense of wanting to care for people. I'm the eldest daughter, so I really have this like motherly quality about me, and I think that really ties in well with being a healthcare professional. So I think physical therapy was the career for me.
Yeah, and I think you'll do really good at it. You know that. How did you first get involved or exposed to oncology rehabilitation? Did you get any of that before us, or we were the first one here? And what kind of impression that created on you when you just started with us?
Yeah, so this was my first exposure to oncology rehab. When I applied for the APK internship, and they sent me the description, and I was like, okay, I'll do it. But I really had no idea what entailed when it came to oncology rehab. And then when I worked a couple of shifts as a volunteer, I got more exposure. Um, but again, as a volunteer, I wasn't doing any patient care really. I was just cleaning tables, supporting the therapist. So before that, I had no idea what it entailed. And now my eyes just are I'm so amazed about the field in general because it encompasses so much. Um, and and yeah, so I'm really grateful to have had this experience early on because a lot of students, younger students, don't get exposed to oncology until later on. So I feel like going into PT school, I'm going to be extremely prepared, and especially at looking at patients much more holistically. Because I do feel like oncology in a way is very holistic in itself.
Excellent. So was oncology rehab something you were familiar with before the experience, or what surprised you the most when you came to CS?
So, like I said, I wasn't familiar with it, and I was honestly very nervous before because, there's this, oncology in general, cancer, it's very sad, very debilitating. So I didn't know what to expect. I thought it would be, kind of emotionally taxing. And I was very decently surprised. Like I come in and there's a lot of positivity and a lot of very good energy. And I feel like, I feel like I'm serving a greater purpose when I come into the clinic and helping these patients who really need it most. Um, and yeah, that really surprised me because, like I said, I've never been exposed to that. And I didn't have anyone in my family that had cancer, so I had no idea how debilitating the disease can actually be. And, it's a whole spectrum.
Right. So if you can share, what role was it that you were here in the oncology with the rehab oncology team? I know as a volunteer, it's not so much because you're just kind of helping the clinic flow.
Right.
But how about during your internship and now that you've been working with us actually, like side by side during this year?
So, as a student, I worked under two therapists. I worked with an oncology therapist, and then I also worked under a pelvic oncology therapist. So I was exposed to a lot early on. Like I saw ortho, oncology, pelvic, very niche specialties. And then now, so after my internship, 4 weeks, getting exposed to all that, now I'm just work as an aide, so I help everyone around the clinic, not just the oncology team. But I do feel like having that strong base of learning in my internship really set me up well as a rehab aide. And I've been able to apply the things I've learned with oncology to the ortho team and kind of, I serve as like this middleman between everyone on the team. So there's knowledge I get from one therapist that I can transfer to another, which I find very valuable.
Perfect. So what type of patients did you encounter and how PT impact their quality of life? If you can give us some examples of like, what specific patients is somebody that comes to your mind, just like, wow, I'm thinking about this patient all the time, or somebody I'm always gonna be thinking in my future career to compare things to.
Wow, that's a loaded question because, there's a whole spectrum of patients that we've seen here. There's some patients that are very debilitated, and then there's also some that just live their normal lives, very active patients. The ones that stand out to me most after working here for over like a year and a half now are the ones that come in like very averse to exercise, and then the more you show them, the more they come in, the more comfortable they get and the stronger they get. And they just come out the other side just completely different people, much more in tune with their bodies, and with in tune with their bodies and exercise. And a lot of, in particular, like older women, like a lot of them have never exercised before in their lives. So I just feel like we just play such an important role in their cancer journey, and they're really, really grateful for being here and getting their mind off of things.
Yeah, you're right. And I think that this is the main thing. And you're totally right when you were mentioned about in the beginning, you thought that was going to be really very emotional taxing. And that's exactly how I felt when I was an orthopedic therapist for many years. And when that kind of came to my play, like if I wanted to do some oncology, and I have no idea where I was getting into it. And that was my first thought. It's like, ooh, this is gonna be very emotional and I'm very pushy and I'm like, I don't know if I'm very high energy and it's like, I don't know how that's gonna be. And the first week I came and shadowed Shannon, I just totally fall in love with this population because I think they're just so grateful. and no matter what they're going through their life, and how, like, sometimes we have patients who have recurrence after recurrence. They dealing with two, three different cancers and different types of their life, and they're like, it's still very, very positive and very like, okay, I need to just take care of one thing at a time, and let's just get on, move on, and try to just continue with life. So it's very rewarding for sure. Um, what did you learn about the physical, emotional, and psychological needs of cancer survivors?
So, yeah, this is a loaded question as well, because physical, emotional, psychological, it's all connected, right? Um, I was able to shadow a bit in the OT, our OT as well, Tony, who taught about coping practices like breathing and journaling, that I've been able to implement in my own life as well. But everything is so connected, right? So exercising well will help the mind, but also having a good mind will get you on track to do more exercise. So I think, yeah, cancer survivors, they are some strong, strong, strong humans. And you know, supporting them in any way as PTs is really just not physical therapy. In oncology, we're really, we see them more than most of their care teams sometimes. So just being there, asking them about their days, like I'm grateful that my job, I don't really have to take notes or anything. So I'm just there to like make someone smile, keep up with what's going on outside of the clinic and asking about their weekends and stuff. And I've gone to have really, really special relationships with a lot of the patients. So it is very, very emotional that I'm leaving, but I really hope that I make a difference in not just their physical needs, but also emotional.
Yeah, and so that was lead into my next question, which is, how is this exposure to oncology shape your understanding what physical therapy can do?
Yeah, no, it dramatically shifted my understanding of physical therapy, because it's like I mentioned previously, like I came into it thinking like, oh, physical therapy just focus on the targeted area that we're rehabilitating, for example, like a knee injury or a hip. But with oncology, it's so much more. You really have to think about the brain, cancer-related fatigue. Um, you have to think of, what support system they have, like what their home life is like, to incorporate exercise programs into their life. How can they make that easier? There's a lot of things you have to cover. And I think, yeah, I think this dramatically changed my perspective of PT. And I hope that when I eventually start my career, that I could maybe do something in oncology, because I feel it feels very, very fulfilling, really. And not to say that ortho isn't or any other specialty isn't, but it's just a dramatically different perspective that you bring to every patient encounter.
And I would love to see that, Maria. It's funny, I don't know if you knew about this, but I have not only, there was an APK student of mine a while back, an intern. She's now a PA working in oncology at Moffitt.
Oh, yeah.
So it is so great that she totally learned the passion for oncology as you did as an APK during her oncology internship, and then just happened to be that her mom had breast cancer during the time that she was doing her internship. So that definitely opened another door to it, really. And we see a lot of breast cancer patients. So yeah, she's doing fantastic in the medical oncology. Actually, she's on the podcast as well. So it will be awesome that you will be my second APK who actually land in oncology in the future, which
We'll
will be
see.
really grateful. So you'll do great if you go. You're gonna do great no matter what direction you go. But
Thank you.
I think that will be something. I think that you have to be looking at a different area with a different eyes and a different head when you're looking at a patient in oncology versus a non-oncological patient or like just a regular ortho. Did this experience change your perspective of health, healing, and resilience?
Yeah, 100%. To be honest, I didn't really have much exposure to health in general. Like, I didn't grow up like going to the doctor regularly, truthfully. And nobody in my family really suffered from any dramatic, fortunately, medical conditions. And just being here surrounded by so many intelligent therapists, and not even just therapists, like I've talked to SLPs, I've talked to OTs, everyone part of the care team, so intelligent, and I've really broadened my health knowledge, and I love to read as well, so reading a lot about research, and I really like to stay up to date with that, and I just love learning about health in general, not just PT, because I think we can play a role in helping someone, not just in PT focus, but
Yeah, in general.
introducing
Yeah.
other alternatives as well.
Absolutely. So again, I kind of like looking more into, it's not just treating a disease, but what can we do to improve a patient, to hopefully prevent for that recurrence again, right? How can we educate them to become
Preventative
healthier so
medicine.
they don't have to deal with the situation again?
Mhm.
Or what else can they do to mitigate a lot of those secondary effects of the treatments that they keep doing during
Yes.
their treatments?
And I think it's key to, like, you're someone in particular that leads a very healthy, active lifestyle, and I think that really influenced me as well. And I think that in turn influences the patients. Like before, I was a rehab aide. I didn't lift weights at all, and now I lift, and I have been lifting for the past year and a half regularly. And I've noticed just dramatic changes in my body and my mind. And I've taken your advice on other things as well. And just talking to everyone here, and like I just think that'll set me up to be a better PT, because that's how you influenced me.
That's awesome. That's awesome. So what skills or qualities do you think are essential for a PT working with cancer patients?
What qualities?
Yeah.
I think you have to be extremely empathetic and sensitive, because you hear a lot of really sad things. And it's really important to keep those boundaries up too. You want to make sure you don't take all those feelings back home and cause
Super
you
important.
torment.
Yes.
But yeah, just being a very approachable person, and really compassionate. Because like I said, like these patients, like they have an allotted time with you multiple times a week sometimes, and they need that outlet sometimes. So being that person there that can hear them talk about whatever can really, really help.
How can undergrad students get involved in more meaningful clinical experience?
That's a good question. I think what I regret as an undergrad student is I would go in shadow, and I would be really, really shy at the beginning, because I felt like I was bothering the therapist or whatever. But I think it goes a really long way to ask a lot of questions, do research at home, and then bring it back to the therapist, and that way you can discuss it, or introduce not new ideas, new exercises. That way you can have more meaningful experiences with the person you're shadowing. And really just expose yourself to as much as possible, I think. So that you're more well-rounded, so that you kind of see what you like. Because I think there can be, unfortunately, a lot of bad PTs, but so if you just stick with one for all your hours, then you won't be able to see other perspectives. So I think that would make a more meaningful experience.
Okay, that's a very good advice. And I think you're right. Sometimes it's so many things, right? Undergrad, it's a lot of, you're younger, you're like, yeah, I'm coming to my internship, but I have all other things I gotta do. You're
Mm-hmm.
not thinking on your career center as much as you start mature more.
Yeah.
And so a lot of things like, oh, that's cool, but that's cool, right? Versus let me just go dig more into that. Let me learn more,
Explore.
explore, yeah.
Yeah, yeah,
And that's
yeah.
some of the things that we always look at the volunteers when they come here, that they're all of our volunteers are undergrad. And it's just not that many of them had that sense of like, let me learn more, let me go beyond what I'm seeing. And
Yes.
those are the ones who are like, oh my God, you're great. I would love to have you as an intern, because what is more fun for me that the student that is engaged and want to learn and want to just, challenge me and kind of like, I'm looking into this research. What do you think about this? And it's all that kind of great energy. So that really is I think that students need to take more advantage of that when you're going through
Mm-hmm.
these volunteer or shadow experiences. So
Mm-hmm.
so what do you think PTA schools should know about the students who bring this kind of experience with them? Or are you gonna teach these people like you said?
Oh my goodness. Um, hmm. I just I just hope that, they talk about oncology and give it a good well lec well lectured couple weeks, hopefully, and like hopefully I can contribute to that in somehow and talk about my experience. But I've heard, and I haven't been to PT school yet, but I've heard, like with more of the specialized specialties, I guess, that they kind of just briefly mention it and throw
One
it in
lecture.
there.
Yeah.
But I think there's a lot you can take from oncology and apply it to other specialties. So, and cancer, unfortunately, it's growing rampantly like throughout the world. So the more, even if you do work in an ortho setting, in a neuro setting, and whatever, you will be exposed to someone, either a survivor or someone.
Absolutely.
So I think having that knowledge base, understanding what the patient has gone through, what medication they're on, everything like that, really, really will hopefully set me up for success. And I hope my school recognizes that, and I can talk about it at some point.
Yes, well, so every time I get together with the clinical coordinator, like I'm the clinical coordinator for this, and when I get together with the different people in different schools who are the ones who coordinate students for their internships, they ask me, what feedback do you have? What should we do better? And it is my same thing over and over. It's like you need to improve your curriculum during PTA school.
Yeah.
And cannot be just one lecture because it's just a lot. So when I have students who
Yes.
come here and I just literally have a student, it's her second week, totally overwhelmed because it's just a lot of information that they never get exposed on it before. And I understand it's a specialty and like medical school, right? You cannot know everything about every specialty out there. But like you can say, survivorship increasing more and more. We have so many more survivors in cancer because locally we have better medicine, better options to treat cancer. So you don't have as many deaths, but it's more survivorship. So you're going to have these patients who had a history of it that has some sequelae from the treatments that they had, and that's going to be your future patient. So even if it's your ortho patient that has shoulder, but perhaps they have a mastectomy and then they have radiation and they already have tinnitus, a lot of things are a consequence of that. So you need to be aware of all those things and not just kind of treat it as a shoulder and then, oh yeah, you have breast cancer before, but now you're fine. You don't have any active cancer. I don't have to worry about that. And again, that was me. That was me during 20 some years of career in orthopedic, right? I'm like,
Right.
oh yeah, you have cancer. Okay, well, it's not active any longer. You're not having issues with that anymore. No, let's just focus in here. And how many people I really miss that, and how many, how much more I could help them if I knew what I know now in regarding how the body is just all together, fascia is all together, and you cannot just be looking at one part of the body without looking the rest. So hopefully that's gonna start to improve in the curriculum, not just at USF where you're going, but any other schools, because I think that's just gonna really be evolving more and more and more as we go. So any last words of wisdom before I let you go?
Last words of wisdom. Um, I don't know. I'm getting this past week and a half, I've just been very emotional about leaving, and I just feel like this job has really like fulfilled me in a lot of ways, and I've created some great connections. I already talked about this. Words of wisdom. Yeah, just take a gap year to really like, I've been able to like take a step back from like school, which is really, really nice, and kind of focus on bettering myself in ways like I mentioned earlier about working out, and then my mental health. And I think these things are so important to be a better clinician, but also a better person. And I think that'll really set me up well for school when I start back again. And yeah, I'm just really grateful for the experience I had here with Durley. And Durley, you're you're just so intelligent
Oh, you're
and
so sweet.
dedicated, and you really like that energy really like seeps off of you, and I really respect that, and I really love that about you. I think it's amazing.
That's awesome, Maria.
Yeah.
Oh, the Oaxaca podcast. We're gonna miss you.
Oh, miss you
But
too.
thank you for being here with me doing this. And certainly, what can people find you?
I will drop my email
Perfect.
in the show notes.
Perfect. So they will be there. So if you guys want to contact Maria,
Yeah.
if any of you guys listening out there is thinking about, APK, volunteer, going into PTS school, gap year, you can reach out to her. You can reach out to her to us. How is first year of PTS school going? And maybe in a few years, she will be maybe one of our colleagues doing oncology. Who knows, right? So thank you again for doing this with me.
Of course. Thank you, Durley.
Okay, perfect. So see you later.